One of the areas of the NCLEX that you lose point is psychosocial integrity, psych NCLEX question, mental health. In this video, I'm going to show you how to answer questions mostly on the concept, how to identify them, and how to master them so that you can pass your NCLEX. Let's get to it. So this is the first question. As usual, you can see this is next generation. It's basically things you know put in the box. What is the question? And this is assessing a client diagnosed with what? Borderline personality disorder, which indicate below which finding should the nurse expect. Is a table. That means the keyword is what? Personality disorder. Regarding what? Borderline. You have to know the features of this, and then you can use it. You have to choose something at each level, but you have to understand what is borderline personality disorder. Which characteristics is the most important in their life, and how do you recognize them? Do they have pressure speech? Do they fear of being watched? Do they have intense fear of abandonment? Do they have high risk behavior or unstable personality relationship? Pause and answer it so that you can keep track of your record. I can tell you, pressure speech, never happy. This is what? Bipolar. Fear of being watched. They don't care about being watched. This is not paranoid schizophrenia patient, right? That's a trap. The fear of abandonment. This is number one. They don't want you to leave them alone. And a high risk what? Behavior. Because of that, I will connect all of them together. Fear of being abandoned. Therefore, they have high risk behavior. If they are in a relationship, they will keep you in. Therefore, high risk behavior. And they have unstable personal relationship in their family, in their spouse, wives, girlfriends, and boyfriends. And so this is very characteristics about borderline personality disorder. This is the way you should think about it. Don't overguess it. Know the underlying concept and apply for your psychosocial questions on mental health. So that's the right answer. This is another trappy question. I will show you which one are the trap. The statement, which statement by the client is most consistent with the diagnosis is a selected apply. And this is assessing the client suspected of having what? Anorexia nervosa. Therefore, what do you think are the features of anorexia nervosa? It's a selected apply. You don't have to select everything. Pick those that you are 100% confident. I think I still need to lose more weight, even though others say I am too thin. Do you think this is what anorexia patient would say? I will eat large amount of food and then force myself to vomit afterward. Is this what they do? I often eat when I feel emotionally stressed and anxious. I avoid carbohydrates because it causes what? Abdominal discomfort. Sometimes I feel like my heart is fluttering. What do you think? Pick your answer and let me know. Number one is the right answer. It's very common in a patient with anorexia. They feel like they need to lose weight even though they look fine. Eating large amount and then forcing yourself is classic of bulimia, purge and then binge and purge, right? I often eat when I feel emotionally stressed and anxious. Anxiety people don't do that. This is binge eating, and it's not the same as what? Bulimia. This is different from that. This is binge eating disorder. It's different from bulimia. I avoid carbohydrate because they cause abdominal discomfort. This one, any other abdominal problem, it can associate it with that. It's not classic with anorexia. Sometimes I feel like my heart is fluttering. This is a trap. This is the concept. This is what NCLEX want you to be able to use to answer question. You know, anorexia patient are usually what? They have electrolyte problem. You expect them to have arrhythmia, tachycardic, and all those things. So that one is the right answer. And that's one you got to pick. So there's only two answers there. If you overselect, you get wrong. So concept, be it, use it to answer the question and analyze them. And this is the answer choice over there. These are questions from my QBank Adapt NCLEX. If you want to subscribe, check Adapt NCLEX and then get to the on-demand section. You get access to this. And let's determine that the client is experiencing idea of reference. That's the key. Understand what is idea of reference and use it to answer the question. Which statement by the client confirm the finding? Mental health psych question, psychosocial, it's not that complicated. Take the words they've given you in the question and use it to answer it. Idea of reference. What is an idea? And what am I referencing to? That's all. The people on the television are sending such secret messages specifically to me. Does it indicate an idea and a reference? I hear voices telling me that I'm being watched. Does that represent an idea and a reference? My thoughts are being controlled by an outside force. I feel extremely guilty about things I did years ago. Idea and a reference? Pause and answer. Which one is your right answer? What do you think? The best answer is this. If somebody is talking to me, you're thinking they're talking to you, but they're not talking to you. It's an idea and then referring to you. So somebody on the TV, they're doing their thing. They don't even know you. They can't even see you, but you think they're giving you a message. Idea of reference. I hear voices telling me that I'm being watched. That is like paranoid, delusional, right? You're thinking about something is happening. Persecutory delusion can happen. My thoughts are being controlled by an outside force. That is delusion of control. And I feel extremely guilt about things I did years ago. This has nothing to do with the idea reference. Male college student told the nurse that he greatly admired his English teacher at first, but within a short period of time began to strongly dislike her. Which defense mechanism is the student exhibiting? First, I like you. A few minutes later, I don't like you. Projection, splitting, bipolar, regression. Pick your answer. There's a trap there. Don't pick it. You pick your answer, I can tell you, don't pick bipolar. Bipolar is not a defense mechanism. I don't even have to define it for you, but you know it's not a defense mechanism. So don't pick it. If you pick it, that was the first thing that came to your mind. We got to go back and learn defense mechanism. Projection, something you do, you say somebody is doing that. I don't see it in the statement. Splitting, hey, I'm breaking it into two, left and right. I hate you, I like you. Maybe. Regression, I'm going back to my old young age. I'm 20-year-old, something happened, I'm like a baby. Yeah, that's regression. So this is splitting, good and bad cap and good cap. I like you, I don't like you. That's the right answer. And this is assessing a refugee client who recently relocated to the community. The client appears withdrawn. One, doesn't want to talk to anybody. Avoid eye contact. Something is wrong. Respond to questions with a very few words, right? Which intervention should the nurse prioritize? Underline the question, find the buzzword. Somebody is withdrawn, poor eye contact, not talking to you. What would you do? Therapeutic communication. Encourage the client to participate in the large group activities. Use a trained medical interpreter during communication. The client to describe current feelings and concern. Ask rapid, direct questions to obtain information quickly. Pause and answer it. Then analyze this question and see which one is appropriate. Don't pick number two. That's a trap. Just because we need a medical interpreter, that's not the first thing we should prioritize, right? Patient is withdrawn, eye contact, not responding to question. Do you think she will talk to an interpreter? There's nothing in the question saying that what the patient has language issue. So I put it there to trap you. NCLEX would do that. The right answer, find more information. What is wrong with the patient? Let the patient talk. I'd ask them to describe their feeling and their condition. Putting them in a large group, they don't even want to talk to you. And then talking to them too rapidly, they're not going to answer your question. That's your right answer. This is also a trap. Which findings should the nurse suspect? A nurse is assessing a client with what? Catatonic schizophrenia. Which findings should the nurse suspect? You have to understand what is catatonic schizophrenia. Select and apply. Clonus, hyperpyrexia, stupor, rigidity, mutism. What do you think? There's a keyword, catatonic schizophrenia. Which of this is expected finding you may see? Pause and answer it. But there's keyword there that will trap you. Don't pick clonus. That's associated with what? Serotonin syndrome. Pick hyperpyrexia. That's associated with what? High temperature NMS. The most common symptoms associated with catatonic schizophrenia is like schizophrenia with severe depressive symptoms. They don't want to move. They don't want to talk. When they're talking, They're repeating your word. They have high negativity. Whatever you say, they say no. They will stay at one place for so many hours. And safety is their key. Therefore, stupor, they will have rigidity, and they don't want to talk. Small words. Those are the features. How are you doing so far? We are on number 7. What is your score? Put it down in your comment section. Let me know where you're watching from. But I want you to get 10 out of 10 in this psychosocial because you got to master it. And this is reviewing the plan of care for a client experiencing maniac episode with history of bipolar. Which intervention should the nurse anticipate in the plan of care? Selected apply. Encourage the client to participate in the competitive group activities. Decrease environmental stimuli in the client's room. Set clear and consistent limit on inappropriate behavior. Use short, simple sentences when communicating with the client. Provide high-calorie finger food the client can eat while moving. Encourage prolonged rest period and sleep. What do you think? If you have a bipolar patient, it's a maniac, which of these should you include in the plan of care? Pause and answer it. The bipolar, they are on top of the world. Too much energy when they are in maniac episode. Therefore, group competitive activity, you're going to worsen their maniac. You should decrease stimuli that will calm them down. You should set a limit. This is what we're going to do. Clear, consistent limit in behavior, inappropriate behavior. And just use a simple short sentences when you're communicating. They're already hyper. If you talk to them in a pressure speech, you're going to activate them. They need some energy, finger food. They're not going to sit down, give them something they can eat and move. And encourage what? Rest so that they can gain their energy back. These are the things you should pay attention to. The next is caring for a client with moderate Alzheimer's. Alzheimer's is part of psychosocial. He became agitated, and therefore he said, I refuse to prescribe medication. Which action should the nurse take? Once again, a nurse is caring for a client with moderate Alzheimer's disease who become agitated and refuse to take prescribed oral medication. Which action should the nurse take? Tell the client that privileges will be restricted if the medication is refused. Explain the medication regimen repeatedly until the client agrees. Remain calm. Reapproach the client later to offer the medication again. Force the client to take the medication to ensure compliance. Keyword, Alzheimer's disease. You want to give them a medication. They said, no, I'm not going to take it because I'm mad. What do you want to do? Therapeutic communication. This is not a trap. You know the answer. Privileges being revoked, well, he doesn't care. If you explain everything you want, they don't understand it. Come back. Nothing wrong with it. Document it. Come back and offer the medication. Remain calm. Reapproach the client later when they are very quiet. Forcing the medication on them is an abuse. And this is caring for a client who was admitted 72 hours and has a history of chronic alcohol use. Which of the following clinical manifestations should the nurse suspect with delirium tremors? Selected apply. Alcohol, 72 hours, you should be in DT. Patient is delirium tremor. What do you expect? I've analyzed the question for you. Always do that. Rewrite it on your own. I have delirium tremor because I've not drink alcohol for 72 hours and I use alcohol. Do I see hypertension? Visual hallucination, bradycardia, decreased level of consciousness, increased parasympathetic activity, and hysteresis. What do you think? The best way to answer this question is alcohol is a downer. If you don't have alcohol, your symptoms go up. Therefore, look for outgoing symptoms. It's a selected apply. You don't have to pick everything. Pick those that you're 100% confident. I'm looking for things going up. Hypertension is going up. Hallucination, specific, is going up. Bradycardia, I'm going down. Level of consciousness going to go up, not decreasing. Sympathetic activity goes up and parasympathetic goes down. This is wrong. Hysteresis is associated with liver disease, and therefore, only 2 answers there. Don't overselect those that you know, and don't get trapped. Last question. What is your score? Before I finish, 10 questions. Which one? How many do you have? Put it down in the comment. The next, you suspect the client is experiencing what? A client suddenly become unable to walk. All of a sudden, you can walk after witnessing a car accident despite having no identified physical injury. I was standing there. There was a car accident. I was not involved. All of a sudden, I can't walk. There's no injury. The next you will suspect the client experiencing what? Factitious disorder, ill anxiety disorder, conversion disorder, somatic symptoms disorder. Which of these do you think is happening to the patient? Pause down, put down your answer. If you need more, another video will show up. It's on psych, medication, and concept. Follow and watch them, and you'll be golden for your NCLEX or nursing school. What do you think? I can tell you this conversion disorder. There's no neurological symptoms to explain the symptoms, but then the patient can walk. Factitious, you causing the thing, you faking it. Illness, anxiety, you worry about something is going to happen to you. Somatic symptoms, usually chronic. If you have chronic condition, you start to have pain everywhere, like fibromyalgia, everywhere, non-specific. That's somatic symptoms disorder. 10 questions. How did you do? Thank you for watching. And if you need more, follow for more content like this and subscribe to get videos whenever I make them. Good luck. Best of luck. Thank you for watching. All the best of luck.